course, it's a very interesting topic because narcolepsy is really a rare disorder, and many physicians even don't remember about this disease. However, it's important to recognize first, and of course, always there's diagnosis and very important clinical symptoms related to narcolepsy, which is, as I mentioned, a rare disorder. The world prevalence is about 25, 50 patients per 100,000 population. And the main clinical symptom is the excessive daytime sleepiness. And it's frequently in 70% of patients, it's associated with cataplexy, which is a sudden loss of muscle strength. And other symptoms include hallucinations and also inability to move, so-called sleep paralysis. There is a genetic also predisposition, and my role in this discussion was to show the arguments that this disease could be an autoimmune disease. But however, there is not yet fully understood the pathogenesis of disease, but many evidences show that and arguments are for the thesis that this disease is an autoimmune disorder, which is the disease that the immune system of the person attacks their own structures. And what I show in my presentation is that immune system, the cellular part or humoral part of immune system is really involved in this disease. And the main target is the orexin peptide. Orexin peptide is an important peptide in the hypothalamus part of the brain, which is involved in making the balance between the sleep and wakefulness. And there is a 80-90% loss of the orexin. And normally this is the target of the immune system. And what are the proof? First, that in these patients with narcolepsy, we find in the blood the cells, CD4 cells and lymphocytes, and CD8 lymphocytes against this antigen, right? The orexin. Another thing is that some groups found antibodies against the antigen orexin producing neurons, right? So what also suggests us that narcolepsy could be an autoimmune disease is the situation that usually to develop autoimmune disease, there are two important factors which are present. First is there's a genetic predisposition, and in narcolepsy patients, we have such a genetic predisposition with one of the HLA genetic antigen, very important in immune regulation, and there is also environmental factors. And here in narcolepsy, we have association with the influenza infections and also streptococcal infections. And a group of scientists from Stanford University also discovered molecular mimicry between the fragment of the orexin, and also a fragment of hemagglutinin protein, which is the part of flu protein. And also that is another argument for the autoimmune hypothesis. What's also more is that autoimmune disorders usually respond well if they are treated with steroids or with intravenous immunoglobulins, which bind autoantibodies or plasmapheresis. And there are some cases described in the literature that they really prove that these drugs diminish the symptoms of narcolepsy. So I showed in my presentation all the arguments. However, of course, my partner in the discussion will talk against this thesis, and also there are some points that could be discussed, and I think that will be very interesting discussion. There are no large studies, and that is a weak point. However, more studies are needed, and there are some case reports when patients were treated by steroids, intravenous immunoglobulins, or plasmapheresis. And these treatments really help these patients and diminish sleepiness, diminish the symptoms of narcolepsy. So this is another, of course, argument to other arguments I presented before.